What if every infant could celebrate their first birthday? To imagine this is to comprehend the powerful influence of modern medicine and public health initiatives on our global society. There used to be a time when infant mortality rates were alarmingly high. As we journey back to the early 20th century, we find a world where infections and diseases were rampant, claiming the lives of countless ones. Substandard sanitation practices only served to fan the flames of this crisis, culminating in a bleak chapter of our history. The tide to turn with the introduction of immunization programs and these widespread initiatives. These scientific breakthroughs sparked a revolution, rewriting the narrative that had been in place for far too long. And so, we find ourselves in the present where the unthinkable is becoming reality. However, the advent of immunization programs and the implementation of these widespread initiatives marked a turning point in this grim narrative. Limited access to quality healthcare, particularly in low-income communities, has been a significant contributor to high infant mortality rates. These regions often face numerous obstacles, disrupting the path to reliable medical attention. From geographic isolation to poor transportation networks, these communities are frequently at the mercy of circumstances, struggling to acquire essential health services. Consequentially, the rate of infant mortality in such areas is alarmingly high. This issue is not merely a statistic, it's a reflection of the disparity between different strata of society, a tragic testament to the inequality that exists. The lack of availability of basic amenities like quality healthcare impacts not only the physical health of these communities, but also their overall well-being, creating a vicious cycle of poverty and disease. Further exacerbating the situation is the inadequate prenatal care that many expectant mothers receive. The dearth of skilled birth attendants implies that many mothers are denied the necessary guidance during childbirth, thus increasing the probability of complications. This scenario is even more alarming considering the risks that it poses to both the mothers and their newborns. Moreover, the absence of skilled birth attendants has increased risks for both mothers and newborns. Maternal health conditions such as obesity, diabetes, and hypertension have been identified as significant factors impacting infant mortality. This isn't an isolated observation, it's a globally recognized concern that's part of a bigger picture of maternal and infant health. Diseases such as obesity, diabetes, and hypertension have far-reaching effects, influencing the health of both mother and child. Medical research is beginning to paint a clear picture of how these conditions can dramatically affect the outcomes of childbirth. Across the globe, thousands of researchers are fervently studying these conditions, hoping to develop strategies that can help manage these concerns pregnancy. Their findings have been striking. They've discovered that proper management of these maternal health conditions during the gestation period can significantly reduce the negative impact on an infant's health. The influence of these conditions on infant mortality is not just marginal. Their role is alarmingly substantial. Recent studies have underscored the necessity of managing these conditions during pregnancy, emphasizing their crucial role in safeguarding both maternal and infant health. The correlation between maternal health and infant mortality is not only existent, but also significant. It's a topic that warrants our utmost attention and intervention. By managing these conditions, we can contribute significantly towards improving the health outcomes for mothers and their infants worldwide. Fast forward to today, the World Health Organization reports a substantial reduction in global infant mortality rates from 1990 to 2019. This positive shift is a result of strategic healthcare initiatives and dedicated public health efforts. Despite this progress, the mission to ensure every newborn lives beyond their first year is still ongoing. Alarmingly, congenital malformations, typically referred to as birth defects, persist as a primary cause of infant deaths. These conditions can be mitigated through preventive steps, such as appropriate folic acid consumption during pre-pregnancy and pregnancy phases. A second critical problem is the occurrence of underweight and premature births, both dominant factors in infant mortality. Concerning practices like smoking while pregnant and insufficient prenatal care can lead to these afflictions, highlighting the importance of ongoing knowledge dissemination and public awareness. However, the journey to ensure every infant celebrates their first birthday is far from over. Public health initiatives have been instrumental in this battle. These programs embrace a multifaceted approach to safeguard the health and well-being of the public. They focus on proactive measures, such as education campaigns that aim to disseminate vital health information to all communities. These campaigns are designed to be accessible and relatable to people from all walks of life, breaking down complex health issues and offering clear, actionable advice. Moreover, these initiatives include organized health screenings, which are pivotal in detecting potential health issues early on. By identifying these problems in their nascent stages, these screenings can drastically improve the prognosis and subsequently the quality of life of the affected individuals. They also serve as an excellent platform for promoting healthier habits and preventive behaviors, consequently empowering individuals to take control of their own health. These initiatives are not just important, but crucial. They strive to foster a culture of preventive care, which has far-reaching implications. By promoting early detection and prevention, they've managed to lessen the burden on the healthcare system and reduce the incidence of various health problems. One significant area where these initiatives have had a profound impact is on infant mortality rates. Their relentless efforts in this arena have not only raised awareness but also implemented preventive measures, significantly impacting infant mortality rates. In summary, the global decrease in infant mortality rates is a cause for celebration, a testament to the collective efforts of healthcare professionals, governments, and organizations. This significant improvement is not just a figure on a page, but signifies real lives saved. It is a direct result of the relentless work done by healthcare professionals, governments, and organizations who have championed the cause of better healthcare and have been investing in research and education. This progress, it's important to acknowledge that there are still many challenges to overcome. There are communities, particularly those that are marginalized or underserved, where infant mortality rates remain high. These communities often lack access to quality healthcare, thereby putting infants at risk. Various socioeconomic factors, lack of education, and inadequate healthcare infrastructure contribute to these higher rates. Significant and sustained investment is needed to tackle these challenges. We need to continue funding research, improving healthcare services, and educating communities about the importance of early child healthcare. Greater access to quality healthcare can significantly reduce infant mortality rates in these communities. This way, the dream of every infant celebrating their first birthday can become a reality for all.